Alright, so this is going to be my trach care skill. Now, before we get into the skill itself, we're going to look at our facility policy and our orders just to make sure we know what we're doing and we're okay to do it. So we're going to start, we're going to knock. Hello, Mr. Malone. My name's Josh. I'm going to be taking care of you today. Saw that the doctor had some orders in for some care for your trach. And I was wondering if right now would be a good time to do that. So you're going to tell us yes. So we're going to grab our sterile gloves, 1 bottle of normal saline, and a trach care kit. So we're going to provide for privacy. We're going to do hand hygiene, and we're going to put on a pair of exam gloves. And right here, we're just going to take this old dressing off, and we're going to observe the condition of the dressing, you know, what kind of drainage is on there, what color it is. It has an odor to it. And we're just going to document that at the end of our procedure. So at this point, we can discard our exam gloves. We're going to take our normal saline, we're going to open that up. And we can also get our trach kit out. We can open, actually, we're not going to open that yet. We'll just leave it there for now. Take that back. We are going to open it. We're not going to do anything with it yet. We're just going to get it open, ready for use. We've got our saline open. So now at this point, we're going to take our sterile gloves, and we're just going to apply 1 glove. That way we can finish setting the rest of our field up. So left hand sterile, right hand still dirty, can do whatever outside the sterile field. We're going to make sure this is above our waist during the procedure. Being careful not to turn our back on it, anything like that. So now at this point, we can dump this out onto our field. And then we're going to take our 2 little basins. We're going to fill them up with our normal saline. And we open this, we lift it if it was already open. Good for 24 hours after it's open. Oop. We just want to keep that right there. So now at this point, we are going to apply our other sterile glove. That way we can finish setting up our sterile field. All right. So we're going to get this out of here. What I should have done is got this saline out of here. So we're just going to use our elbows and put this right there. Not turning our back on our sterile field, not dropping our hands below our waist, all that good stuff. So inside our kit, we have a new dressing, which we won't need till later. We have some ties we won't need till later. What we want right now is this little thing so that we can open up our sterile field a little bit. We're going to place one of these over here, kind of designate one as dirty water and clean water once we actually do get around to starting the procedure. But before we do that, we have to place this over our patient just to make sure we keep him clean throughout the procedure. just gonna put that down right there. All right. So now at this point, we could take our trach ties and make them into figure eights. I messed up on this skill earlier, so they're already into figure eights, but they'll come straight and you just twist them into figure eights. We have a gauze piece that's going to be used to dry our little piece we take out of our patient. We have some long Q-tips that are going to be used to clean the inside of the trach. Then we also have this big pipe cleaner looking thing, and it's going to be used to clean that piece removed from the patient.
They are the old, beat up, rusted out cars that are.
Okay, so now we can actually start the procedure. So we're just going to start by removing the old trach.
Because you know how like Brazil has.
And we can kind of anchor this with one of our pinkies.
They do the same thing. They do it in Venice, and it's always in February.
And remove the
Louisiana has
little piece. We're going to drop that in our dirty water. We're going to try to not work so much with this hand now that it's dirty, because it's what we use to actually remove the little piece. But now we are going to take our pipe cleaner. We're going to grab the trach. And we're just going to clean the inside of it, like so. Okay, so it's clean. Now that it's clean, we can rinse it. And we're just going to place it on our little 4x4. It's not a 4x4. Our little piece of gauze, so that it can kind of air dry before we put it back in the patient. So we're done with this, don't need that anymore. Now at this point, we can take our big long Q-tips and just kind of clean the inside. We don't want to go too deep because people have dropped them before, which is not a good look for us or our patient. So don't do that. We're just going to kind of work in a circular motion, you know, getting all around right there. Now at this point, we can take our little eights we've made and just kind of clean over up top, and then we're going to flip it around, transfer hands. So he's holding the dirty part that we just cleaned with, and we're going to clean the top. At this point, we're going to grab us a new little 8. Going to get underneath, work the sides. We're going to do that on this side as well. So this patient's trach's actually a little funny. It's actually coming out of his throat. Don't want that. We would report that, but that's what we're working with right now. But we're just going to get up top, around the sides, underneath, just making sure we get all that. So now at this point, we're going to take our cleanest hand and we are going to grab the patient's trach. We're just going to lay that there, pick it up, and we're going to reattach it. You should hear it snap into place. Make sure it's anchored, that way it doesn't fall out. Then now at this point, we're going to take our little dressing here. It's kind of hung up with my tie a little bit. There we go. And we're going to be really careful just to touch one side of this. So the side down, closest to the patient, we don't want to touch that. The side up that we can see, that's the side we're going to touch. We're going to kind of fold it up so that it's all the outside side. And then we're just going to slide that up under his trach. And then before we folded it up, we're just gonna grab it and pull it through.
Just like what we did here. Really? Yeah. And I mean, I've eaten at many different.
This mannequin's trach is not in the best shape, but we're just trying to work with that the best we can.
About halfway down towards pizza, when it's the main town pizza.
There we go.
We didn't actually go on there, it's very close to pizza.
So we've got his trach dressing on there, and our last step, I'm not gonna do it with this mannequin because his trach's falling out. I'm afraid if I cut those ties, it's just gonna come apart, but we're gonna cut our ties. We're gonna look at skin integrity because those ties, they've been sitting on the patient's neck, so that could be an issue you run into. But after that, we're just gonna retie the trach ties, you know, tie one side, wrap it around, tie the other side, just to kind of keep it stable, hold it in place. So we're done with our procedure now. If the patient's on oxygen, we would have placed a pulse ox on him and had him oxygenate potentially a little bit if his sats felt too low during the procedure, but this patient is not. We're gonna clean our area. We're gonna document our procedure, our findings of that dressing earlier that we had. How the patient tolerated. We're gonna put the bed in the lowest position. We're gonna clean our area, get rid of our gloves, do some hand hygiene, and make sure he's got his call light. Whatever he had on the table, we're gonna give that back to him. But that is trach care. Thank you.